We've received complaints from patients about shortages of certain medical supplies at the country's main referral hospital, RVTH, now Edward Francis Small Teaching Hospital.
Blood line blood ka circulate men kono e ka ofanasa ofana it costs $850.
And the kati which where when you normal saline you buy the normal saline
catheter everything is a cafe lasan nima soto you not do dialysis so there are patients many alunko because soto no dialysis cancel because of him they cannot provide it. Yes, whatever Najifa
have to provide this should come out, in the open and tell people that they are in short of these materials. All right, because if it happened that they don't have them in the country, then one can understand. All right, but they don't have them in the hospital, but they will refer people to places there where they will, to go and buy them. And sometimes those people will in fact bring them to the hospital and sell it to the patients. So if they can do that, why wouldn't the hospital make the arrangement to buy those things from those people and bring it for the patients to use? Right? If you bring somebody all the way from the village to come and do dialysis, they will not survive it, they will die. Mm-hmm. Even the richest person cannot survive this dialysis. Because the amount of money and all of that it requires is too much. After all, they are not being properly taken care of. You cannot imagine somebody telling you that because current went off, you cannot have dialysis. Even if it means that a separate generator, should be put in place for those who will be doing it, because this is their lifeline. This is their lifeline. Which is their lifeline. If you don't do the dialysis, only God knows whether you will survive it for the next time that you go for dialysis. All right? And some of them will be there until late night because it takes time to do the dialysis. How you go home is your own business. Once they do your dialysis, you have to arrange your way to go home, which is even risky. Right. All right? Where they live, you don't know. How they go home is still, So it cost-wise is very expensive for them. On top of it, I mean, it's just unbearable. And these are things that, people are saying, those Dr. Bittaye know that these things are happening.
We decided to find out from Dr. Mustapha Bittaye, Chief Medical Director, about the claims. How true are we with the information that we are getting regarding hospital supplies running low?
Yeah, thank you very much. And we commend you for also, trying to get a comprehensive story. I think that's the way to go. And yes, I think if we get the specifics, we will answer. The hospital doesn't have everything. Yes, there are things that are lacking, and there are things that we have. So if there are specific questions of things that are lacking, we'll tell you. But one thing you have to note is that the hospital specifically buys few items which are usually difficult to get, difficult to source, and those are the ones we buy and put. But the others we ask patients to buy, because the hospital cannot buy everything. Yeah, so there are some drugs which so the hospital orders those ones, get those, make sure those ones are available. But the other ones that can be easily gotten from, and they are cheaper and easy to get from any facilities or any pharmacy, usually the patients have to buy those.
For instance, that was they said there is shortage of dialysis there, so which is very critical for patients who come there.
I mean, I don't know who is saying that, but you see, the dialysis is one thing that gets all the money from Minister of Health. I have to thank the Minister of Health for providing dialysis free of charge. Nowhere in the world will you give dialysis like that. It's very expensive, but when they come, all the dialysis is free. Now, when certain, like right now, acetate is not available. Out of the 20 items you need, so they ask them to buy acetate. They have dialysate, they have all the other things. But for now, dialysis has been absent for maybe 2 months, and government is trying to source it. But everything else is free. So so if things are absent, you buy it. And I think we have to commend the government for providing dialysis free of charge. You can go around and see who provides these expensive things around like that. And recently, the government bought a state-of-the-art water treatment plant. If you go to the dialysis unit, the water treatment plant there is state-of-the-art, very expensive. About, I think it was bought for about 6.4 million. Then you have about 40 machines, new dialysis machines, which are just brought recently by the government. So the government, for me as CMD, I'm very grateful for the support they are doing. And I think once a while, if small things are lacking, people should do their effort at least to get it until the government gets it back. And that's what I have to say about that.
Um, the hospital has been going through challenges. When you were appointed chief medical director, there was a lot of staff morale was low, and there was a lot of reports of corruption and mismanagement at the Edward Francis Teaching Hospital. You took over at a time of critical crisis. How are you able to sustain the momentum? It seems a lot of people are now coming back to say the hospital not much has improved. What do you have to say about those allegations?
Yeah, I think people are entitled to their opinion, and I think there's a lot of room for improvement. I'm trying to make sure that the basic needs of the staff, we are able to meet them. As a CMD, I'm not, as far as I'm concerned, I have a lot to do. I have a lot of room to improve on my targets. I'm not meeting them. My number one target is to make sure that all staff meet their basic needs. That is, I pay them their salary on time. I make sure that they have the required basic things, toilet, on-call rooms, basic things. I'm not meeting that yet. I want staff patients to come and meet their basic needs there. Like they should be able to do all the tests and get all the diagnosis. Now, if they have to get treatment outside, it's fine. If they have to buy drugs, that's okay. But at least the basic labs and all that should be available. I think we have done very well in that. Before, if you come to the lab, most of the tests are not done. Now, if I give you the list of tests that we are able to do, you'll be surprised in Banjul. And we are also working at Nemban as well. Nemban has started improving. They are doing full blood count and other things. So it's improving there. We are getting a new CT scan. It's already in country. The CT scan we used to have used to be 2 slides or 4 slides. Now we have 128 slide CT scan. So X-ray is there. It's working now. We are trying to make sure that Nemban also has CT scan. So a lot of things has happened. And but still, we don't think that we've reached because we have a 4-stage target. Number one is to meet all the needs, basic needs of the staff. Number two, to meet the basic needs of patients. Then number three, we reach the privileges for staff. Then we reach privileges for patients. But we are right now at the basic for both staff and patients. But if you look at what we are able to achieve within the basics, is a lot for people who know. But people who don't know and they feel like nothing is happening, we are really happy to hear their criticisms and we take the positive part and work with it. And that's what we are doing right now.
What about the report that we received that there were 5 neonatal deaths?
I don't know what you are talking about because we look at the deaths, the trends. We have gotten no report that there is an increase in deaths in the hospital. But of course, in the hospital is where people should die. If people die at home, is the problem. But what you look at is the trend. Last year, this time, did you have an increased number compared to the year before, or is it going down? But to say nobody dies in a hospital is just a dream that you can never achieve anywhere in the world. So the place where people die is in the hospital. What you assess objectively is how are they doing? How is the hospital doing? Last year, 2 years ago, number of deaths by January, by December, how is it doing? Trend analysis, like actual numbers and all that.
We're talking about neonatal, not, the common, ailments or, people coming there who are sick with other sicknesses.
Yeah, you know, neonatal is like children who are below 1 month old, like from birth to 1 month. So I can tell you their care has improved. We have a professor of neonatologist who is the head of department. Is a professor who is a neonatologist. So the care has improved. We have more residents who are neonatologists. Right now, we have an issue with the roof that has been leaking for so long. We are fixing it, and because of that, they are cramped up. Now, there's a lot of inconvenience for them during this last 1 or 2 months because we are fixing the main neonatal unit. But that is because we are doing some work there and it will be done soon. Then they go back there. So they are having a lot of inconvenience. But that doesn't mean that it has increased the mortality deaths.
So, what do you say about the issues that you talked about regarding improvements at the hospital and patient ratio also, and the fact that patients are complaining that they have to go and buy acetates? How soon will that be resolved?
No, for us now, before, for example, in the hospital, water is not available. Now we fix that. We hardly hear lack of water problem now. Most of the time, we work with NAWEC and all. Now, before we used to have lack of isoflurane, surgery is not happening. Now we are making sure we have flooded the hospital with isoflurane and others. Basic things we are lacking. Now, when it comes to other things like antibiotics, things you buy at the pharmacy, people can buy it. We are not going to fix that anytime soon because the resources we are making will not be able to do that. So what we are doing is the most when they come, they don't have to look for those ones because those ones we order them, we get them from America and other places. But things that you can get from the pharmacies, you buy it, paracetamol, basic, simple, cheap things. People can buy those ones. And we are not fixing those ones anytime soon. What we are doing is the most difficult ones is what we are sorting out. And that's where we start, then gradually come to those ones. And the government is working. For me, the most important thing about dialysis working, making sure the machines are available, dialysis are available, water treatment plan is working and all. But the other things that you can buy here, if we don't have, people buy it. If it is available, then we have it. Government is trying to source it. There's a procurement process which they follow. One of the items because acetate is finished, and so they get it.
So, is it normal?
Whenever they have it, we are following up on all that. Whenever it's available and free, all drugs, when patients come to the hospital, they get everything free. That's the ideal. That's what the government wants, but it's not possible. People have to know that. Right now, that's not possible. Yeah. So all the people who come to all the hospitals get all the drugs they come for. Everything they need, they have it. That's what government wants. But as of now, that's not possible.
So, is it normal for patients to come to the hospital and ask and buy medicine from pharmacy? Is it normal?
It's very normal. You go to Dakar here. When you go, you just get a prescription and the rest you buy it. Well, you are in US. Go to any US hospital and see what goes there. Whether you just go and they give you everything free, everything you want. When you go for you yourself, if you go to hospital, what do you go to? So look at it and then you tell us.
But for a poor country like the Gambia, not many people, even if you make the comparison like Dakar or US, Gambia is Gambia. Every country is unique. They have their own unique situation and their own unique challenges.
No, I agree with you. That's why government, look at what patients buy in Gambia. It's not a lot. When you come, all the basic things you get it. It's only that the easy ones to get, the not expensive ones, that's the ones you buy. But if you come for surgery like isoflurane, all the anesthetic drugs, everything, you get it free. Or it's just part of the payment you make. So it's not a lot. But the other things now, like the government buys it, but sometimes it's not available in the hospital. And so, or there's a gap in between. But if you look at what government is doing, what they want is to make sure all these things are available all the time, free of charge or what the minimum cost. But that's not possible. It's not possible that all the time it's there. The government orders paracetamol and all this all the time, but there are gaps sometimes in between. It's not always in stock. Sometimes it stocks out. And when those times come, people have to buy it. That's all I'm saying.
So finally, what is the way forward at the Edward Francis Teaching Hospital?
Thank you. For us, we have a target. We want to make sure that number one, all the staff have their basic needs. Staff who are there should be paid on time to be comfortable and all that to be able to take care of their patients. Number two, we want patients who come there, even if it is that they will pay, but the services should be there. There should be the basic services there. So for the laboratory, imaging, the intervention, the surgeons, and all that, the capacity should be there. And I can tell you that there's a lot of improvement in the capacity. If you go there now, before you don't have radiologists. Now you have like 2 or 3 radiologists on the ground. These are consultants. One of them is a Gambian. You go to radiology, you go to urology, I'm telling you that the head of the pediatrics is a neonatologist. Although they are all expatriates coming from the sub-region, but the level of care has improved because of these experts we have there. And then we are training young Gambians to be doctors and to be specialists. That is ongoing in the Gambia. These are big things and they are sustainable. So there's going to be changes in the way the quality is going to improve because all these doctors we are training specialists. So where you used to have only medical officers running the whole place, now you have specialists there. You have cardiologists. You have all these people are specialized people who take care of. So in medicine, it's not only about, but Gambians, they don't know about, most of people don't know about specialists. Once they see a doctor, they think all of them are the same. But there are some people who take a lot of their time in their life to specialize, to look at one branch of medicine and master it so well. And so when they deliver service in that area, it's a high level service. And this is what the hospital is doing. We are making sure that those things are available, those functionalities are there. But now, the government is really going extra mile to make sure that the comfort of the people is even improved. Now, if you go to our renovated wards, you have ACs, you have nice wards, that patients are, when they go in, they're highly dignified. You have piped oxygen everywhere now. Patients don't have to be wheeling cylinders everywhere. So it's easy for people to criticize, but they should come and see what is happening. If you come to the A&E, it's highly congested. The reason is because we are doing renovation of the ICU and others. So most patients cannot all fit. The patients that were so the place is a little congested. But very soon those rooms will be done, those wards will be done, and patients will be moved back there, and the A&E will be free. We've already opened up the sanatorium so that the overflow of patients in the A&E will go to the sanatorium. That place has about 20 to 30 beds that can take more patients. So the hospital is doing what it can to make sure that everybody gets the best care you can available in the sub-region, as well as give you the dignity that you deserve. And once a while, there will be stock out. That's the reality, and people should buy those things and make sure that the treatment is not interrupted until the stocks are in country. This is what we need to do. And we want everybody to support what the government is doing, what the hospital is trying to achieve, so that we can achieve it faster. But all the criticisms, all these things, they just help us to be stronger. We listen to them. And then where we can improve, we improve from. Thank you.
Thank you so much, Dr. Mustapha Bittaye.